Thanks again, Dr. Scott Regenbogen, for talking to OnSurge. Let's talk about rehab. Let's talk about prehab. What conceptually is prehab?
Well, you tripped over the word there, but I think that only shows kind of where the word came from in the first place, which is, it's an invented word. Your spell checker won't recognize it. But prehabilitation was the idea that we shouldn't be focusing just on helping people recover from surgery, but that we can do a lot of good by helping them prepare for surgery. And at least in my institution, at the University of Michigan, prehabilitation really was a bit of a observation of what some of our most respected and senior surgeons were doing. So just down the hall from me is Mark Oringer, a thoracic surgeon very well known for spreading the transhiatal esophagectomy in the United States. And Dr. Oringer was renowned for being able to get patients through operations with good outcomes. And people really tried to take a look at what he was doing and ask him, well, what do you do? Well, one of the things people observed was that he really worked hard to get people in shape before he operated on them.
So what are those elements, goals preoperatively?
Yeah, so here at our institution, we have something called the MSHOP, the Michigan Surgical and Health Optimization Program, and it focuses on four categories. So it focuses on nutrition, it focuses on breathing, so it's incentive spirometry, quitting smoking. It focuses on exercise and walking, and it focuses on stress reduction. So the patients who enroll in the MSHOP, which for me, that's really anyone I think could benefit from better fitness before surgery. They get a pedometer, and based on their pedometer, they are given goals for how to increase their walking and instructions for how to do it. They are given an incentive spirometer, taught how to use it. If they smoke, they're given smoking cessation counseling. They are given nutrition counseling and assessments, and if their nutrition is really poor, they're given intensive nutrition therapy with some commercial products before the operation. But if they're not, they're just given good counseling on healthy diet and nutrition before surgery. And the stress reduction, so recognizing that patients have a lot of psychological stress and worry going into surgery, and time is spent focusing on that. It's challenging for some patients. So some patients, you just don't have time.
Sure.
So cancer patients, but I am a colorectal surgeon, and rectal cancer patients are a great opportunity because they often get preoperative therapy, and I may have 3 or 4 months from the time I meet them until surgery. So we get a real opportunity to help the patients think about how they can be part of their recovery.
Excellent. And have you seen outcomes change there locally, or is there data for more widely known data about the outcomes advantage?
Our local data, so in our institution alone, not yet published, but this was looked at by Mike Englesby, who is the director of our MSHOP. He's a transplant surgeon. Mike looked at a bunch of patients who went through the MSHOP and matched patients who had same operation, similar age, similar comorbidities, and found that there was about a 2-day reduction in length of stay and a substantial reduction in variable direct costs attributed to their operations. Not a perfect comparison. There may be some selection bias, but sure, that suggests to us that it's working. However, the published trials, which have largely come from Montreal, where Francisco Carli, who's an anesthesiologist, has been a big proponent of prehabilitation, most of the results from Montreal have actually not been that exciting. So the differences have been small, if at all. It hasn't stopped Dr. Carli from really pursuing it because it just has so much conceptual face validity. But it's been hard so far to really demonstrate a major difference in surgical outcomes.
Mm-hmm. So in your practice, are there certain circumstances under which you'll delay surgery for the sake of prehab?
Relatively few. Unfortunately, it's pretty unusual that I get to really choose when to do an operation, but I think there are certainly other fields where that is the case. So if I was, for example, a complex hernia surgeon, I think in hernia surgery it's become pretty well established that weight loss to maximize the chances of success is time well spent. So I think I would absolutely think about it there. If I was thinking about treating someone for diverticulitis, maybe, although even those patients these days tend to have pretty ongoing illness. Mm-hmm. But inflammatory bowel disease is challenging, although we do focus a lot on preoperative nutrition for those patients. Mm-hmm. And in cancer, we often don't have a lot of time, except for the rectal cancer patients, where I do use prehabilitation very extensively.
Mm-hmm. Now, are there some large ongoing trials that you're aware of? You mentioned just local data and some Canadian data.
I don't know. I do know that the Montreal group is continuing to examine their own cohort, but I don't know of others. There probably are.
All right. Final words. Pre-hab.
I think rehabilitation is, again, it has such good face validity. I think it's clearly something that is worthwhile for most patients. If nothing else, even if it doesn't necessarily change the physiologic outcomes of surgery, I love that it gives the patients a sense that they have some control over their outcomes and gives them a real feeling of responsibility.
Yeah.
Not just the idea that I'm going to show up, my surgeon's going to take care of me, but we're going to work together and I'm going to have a part in my recovery. So even if nothing else, I think that has some real value to it.
Yeah, sort of changing the way patients see surgery.
Definitely.
Excellent. Thanks again for talking to us, Dr. Regenbogen.
I appreciate the opportunity.
Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook, follow us on Twitter, and find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.